As the pandemic rages on, the question of who is allowed to travel into Grenada after testing positive has been on the tip of the tongue of concerned citizens. A person who was recently infected by the COVID-19 virus may be allowed to travel to Grenada after providing evidence of a recovery. Acting Chief Medical Officer Dr. Sean Charles says individuals must bring forward documents to prove they have recovered medically.
And this evidence include: you must present the positive test, all right, on a sample taken no more than 90 days before arriving in Grenada. So it's not like you tested positive in June last year and you can just come into Grenada without any. No, it cannot be more than 90 days. Because beyond that, you get a positive test. We'll consider there's the potential that you might have been reinfected with another variant.
Dr. Charles notes that it does not stop at a negative test within a 90-day period, as other documentations are required.
And so in addition to the original positive test that should be no more than 90 days, you must carry a letter from your healthcare provider or from a public health official stating that you are cleared to travel. All right, so that's 2. And 3, you must have a negative antigen test within 1 day. So you need to work with these 3 items. You recently had COVID, you're traveling in, all right, you must work with the original positive test, a letter from your healthcare provider stating that you are cleared, and a negative antigen test taken within a day.
The Acting Chief Medical Officer says for individuals with no history of being infected will follow the regular protocols of providing a negative PCR test within 72 hours of arrival. Meanwhile, reiterating the importance of following the basic protocols, Dr. Charles notes the changes to quarantine and isolation protocols.
Now, for fully vaccinated persons, these persons will not be required to quarantine following contact, except if they reside in the same household with a positive case.
He explains the difference between quarantine and isolation.
So quarantine is what happens after you are in contact with someone who tested positive. All right, so you have not tested positive yet. You are just a contact, all right? The duration of quarantine is 7 days. You're tested, you're negative around day 7, quarantine ends. If you are unvaccinated, you have to continue to self-monitor for another 7 days, up to the 14-day period. Now, isolation is for after you test positive. So now you have received a positive test. If you are fully vaccinated, the duration of your isolation is 10 days. If you are not vaccinated, the duration of your isolation is 14 days.
The CMO says a repeat test is not required unless in cases of an early clearance, whereby a negative antigen test is received for a fully vaccinated person 5 to 7 days and 7 to 10 days for an unvaccinated person. I am Gerard Joseph for GBN News.